with us someone from Mongolia, and we have Anu with us, and I'll ask Anu to introduce herself, tell us a bit about your work, what you do, and just tell us about yourself.
Hi Nandini, and hi to all LASAP partners. My name is Anudari. You can call me in short Anu, and I work with Women for Change Mongolia. We are an NGO, and we have established about 10 years ago now, and it's all founded by young women back then. We have programs, especially focusing on the gender mainstreaming and fight for the gender equality. So the main job we are doing here is the first thing is raise awareness on the gender-based inequality issue among the public. And since gender equality issue is quite a new issue to Mongolia, since but it's being like really recognized in last 4 or 5 years, because many young people are coming back from abroad with the knowledge and the of this of the issue, and promoting the issue on the level of academia, as well as in the civil society and in the broader public. So the second thing we do is we focus on empowering ourselves, young women, and yeah, we have many programs that are focused on the empowerment of women, urban women as well as local women. So there are well-known 2 programs of our organization. It's those are the leadership and empowerment programs. One is political leadership program, and the other one is the Voices for Change, which is the main participants are the local women who are giving their voices in their local community and having their local women's community and raising their issues and seeking for the solutions. Yes, and we are helping them to build their women's community in the provinces. We call them AMACs. So yes, and we're also not just limited to the female audience. We also engage men in our work. We focus also on youth and youth civic participation. So these are the main focus of our work. Right. And in the context of SRHR, we mainly work on the field of the raising awareness and advocacy in relation with the SRHR. We released magazines, brochures on the issue of SRHR. We promote also safe abortion and abortion rights. We have the community of over 100 women, young women, who are our members. So they were involved in the ASAP training in Mongolia, and so these are the work we do in terms of SRHR. Also, in relation with the SRHR and safe abortion, a little bit about the background in Mongolia. abortion is quite a stigmatized
Mm.
uh, idea in Mongolia. Uh, I think it's the same
Mm.
in every other Asian country. But abortion is legal.
Mm.
It's decriminalized after the fall of the socialist regime
Mm.
in Mongolia in 1990s.
Mm.
So yeah, and abortions are just as to the legal background, it should be uh, performed by the professional, medical professional, and the self-managed abortion is prohibited.
Mm.
And the abortion should be just performed by the medical professionals. The, the medical abortion also, as well as the uh, abortion with the pills.
Mm.
And uh, um, since we are working a lot with the working on the advocacy
Mm.
and promoting the sexual and reproductive rights, the challenges we face is obviously the stigma of the public on
Right.
the issue
So
and
I'll
the misinformation on the issue, and
so I'll
also the
just wanted to ask you. I think we're
Mhm,
moving towards my next question, so I'll just add it
mhm,
here so you can give us a bit of the bigger picture that you're already giving us. You've already mentioned about stigma and the lack of, an supportive environment, like in many other Asian countries and probably beyond Asia as well. But my so you've already giving us a bit of that. I just wanted to also know, for understanding what was the situation in Mongolia even before the pandemic hit you. So, in terms of, yes, specifically to SRHR and abortion rights, but also the larger issues that somehow maybe directly or indirectly affect SRHR and abortion. Like you're already giving us a bit of that glimpse, the challenges. So, what was the situation like even before COVID-19?
So, in terms of situation with women in specific, for example, the healthcare frontline workers are majority of them are women. It's like up to 80% are women, and they are also like in working in the front line. And um, it's in Mongolia, it's a public medical care, so the salary is really low in the healthcare service. So it's like really um, affecting women who are working in the service, majority of the healthcare workers. Also, even before the uh, pandemics, women do a lot of unpaid care work in the home. So now it's like the issue is raised, but women had the same struggle before this regime. Also, with the healthcare service and with safe abortion access, there is a lot of misinformation and also lack of the adequate information among women, especially young women and girls. So that's the ongoing uh,
Mm-hmm. And
situation
what was some of
problem.
the gender gender based issues or like issues that you were facing in terms of women were facing in the country, you know, and are trans people and queer people also represented, and what are their issues as well, if you have any sort of insight on that? but what were like the major issues that women were facing?
So the major issue facing women in Mongolia,
Hmm.
it's um, a lot of people say, even people who see Mongolia from the uh, overseas, they say like, oh, Mongolia is, they have a really like good performing gender equality situation. A lot of if you see the like basic statistics and the lifestyle, women in Mongolia are quite empowered, um, are really educated. Uh, girls are more educated than boys, and women seek like academia more than uh, men, and also women pursue the professional uh, professional studies more than men. And in the like on the surface, the situation looks good,
Hmm.
but yeah, we have a lot of the same. We share the same gender-based um, discrimination um, as any other country, such as gender-based violence, domestic violence issue. So during this pandemics, a lot of countries report that domestic violence reports and calls were spiked. It's the same with Mongolia, but it's like it's really drastic that changes, which is the domestic violence reported incidents increased up to uh, 87%, which is twice twice bigger than average
Hmm.
of
Hmm.
the
Hmm.
world.
Hmm. So thank you
So
for,
that's the
yeah,
biggest issue.
yeah. That thank you for bringing that. So I think a lot of the issues with countries like Mongolia is like they are left out of the map of the mainstream media, so we don't get to know what's going on there, and we build myths around those the countries that we don't hear about often. So it is really important to hear from Anu that the situation in Mongolia, and on the surface, gender rights and status of women seem all fine. And now,
Yeah.
with the pandemic hitting, it is becoming more and more apparent that it's not all fine, and that domestic violence has increased just like globally. So it's following a very global trend, which means our movements still have so much work to do in terms of building rights for women and trans people. So I think we have so much work to do. And
Sure.
Anu, you've brought me to my second question, and you can sort of unpack it a little bit more. You've already talked about healthcare workers mostly being women, and the healthcare
Mm-hmm.
system being funded by the government, the public system, not paying women as much, so that compromises a lot of their issues. And and the domestic violence issue that you brought up, that on the surface things are fine, but they're not under when you scratch the surface. So those are very important points. But and you're already brought in that how the pandemic has started affecting people. So just wanted to know from you now, from that situation to coming forward to the time that we are living in today, where the pandemic has become a global situation. I know Mongolia also has closed borders, and we were supposed to have a meeting, we had to postpone it. So I want to know from you,
Yes.
what is the current situation, and how has the pandemic hit the country, and specifically how are you experiencing it in your work? Like, how is it making the issues that you work with even more challenging, and access to SRHR and abortion, safe abortion, even more difficult, or if that is happening? So if you can tell us a bit about that.
Yeah, sure. So here in Mongolia, we have over 30 confirmed cases, but those are those cases where the people were contracted the virus overseas, and all the confirmed cases are from the overseas, so they are quarantined upon arrival, and the country itself is not in the complete lockdown. We are in the regime of heightened preparedness, so people are just encouraged work from the home, and but the publics, all the schools and kindergartens are closed, and the public gatherings such as forums, seminars, those are prohibited. And yeah, but we are still, for example, our organization, we are still working from the office, and however, there was an temporary regulation for women from the government of Mongolia, which has regulated that women can work from home or part-time during this regime, and the employers should support women working from the home, and they are paid as usual. So that was of the regulations that was focused on women. However, that increased women's unpaid care work at their homes. So women are really challenged working from home during these days. Also, the sectors like the SME and service work sector, they are facing a really big hardship. Some companies, some small businesses, they are facing bankruptcy. In those sectors, the majority workers are also women. So women are like badly affected with this pandemic regime. And as to the access to the health service, so for example, during this regime of like 3 months, there were like several times of when government closed the country roads, also the road to the city and from the city. So during that time, we assume that women couldn't access the basic health care because they were just allowed the like very, very urgent cases were allowed to come to the city hospitals, or even within the provinces. So that also challenges the basic health service. As to the safe abortion, there is like no such reported cases where there was like incident of people had some complications or any other cases. But if you go to the government websites or even you call the officials, we couldn't access the information on how what measures they will take, what preventive measures they're taking, and what measures they will take when the situation will get worse. Yes, so there are so probably there will be a lack of regulation regarding the access to safe abortion.
Right, right.
if we go to the more strict lockdown or more
Strict
strict
lockdown.
regime.
Right. So
Yes.
as of now, that hasn't happened. So I'm just trying to understand from our situation here in India, where we have a much more severe lockdown going on. So access has already
Mhm.
is becoming a very big issue, and I think many countries are now advocating for abortion as essential services. But from what I understand in Mongolia, that is not the situation yet. The hospitals are still open for all kinds of issues and abortion issues as well. But we know, given the stigma around, it will only get difficult if there is a more stricter lockdown. So, so thank you
Yes.
so much, Anu, for bringing that. And I think you've also you've mentioned another important point in terms of economy, that many of these informal sector economies that are right now suffering the worst under the, pandemic because of the global markets shutting down and disrupting economies worldwide. A lot of the informal sector employs women. So
Mhm.
there are the poor, but amongst the poorer there are this other category that has been historically vulnerable. So I hope governments worldwide, governments in your country, look at those vulnerable workers and women workers especially, and offer support, because that is another big issue that I think worldwide we'll face, and we are already facing it here in India. So in, informal workers and support for them. So I think these were very important points, the economy and how it is impacting women, and then the access to SRHR and abortion rights, which is right now at a very critical juncture, because as
Yes.
cases will peak and hospitals might get shut down and cater only to COVID-19 patients. So what happens then? So having that preparedness ready, a preparedness plan ready, because abortion cannot wait. It is very time sensitive. So
Mhm.
thank you, Anu, for bringing those very important points. So how, what are you, and as an organization or as a part of a movement in Mongolia, doing to sort of, support women or support, through this phase, and also like making sure that when this becomes even worse, that there is somehow that you provide some support. Like, do you have any plan in place for this situation, and also moving forward when, if the cases peak, and what happens then? So
Mhm.
yeah.
So yeah, as first of all, as an organization, yeah, we have facing a lot of challenges because our organization mostly we are project based,
Mm,
and also the main activities we do is workshops and seminars, meetings. So those are all prohibited. We are now just in the midst of learning,
mm,
doing everything online. But you know, the access of online is also internet is also very problematic.
mm,
It's we can't tell it's 100% of access. Um, so now for now our we are just uh, on the stage of preparedness, like we are preparing for everything, but not really uh, like doing the activism, or uh, we can't really act during this pandemic times because it's really uncertain for us
mm,
as
mm,
an organization to move forward.
mm,
For women, uh, we are serving our community,
mm,
so it's like our members, about 100 women, the alumni of our programs, and local women. We are all in touch
mm,
online,
mm,
but still we can reach some our local
Mm.
partners because of this situation. And people also, even there is an access, even there is an access to the internet, and even there is some gadget you have, but still you need some the literacy of using those gadgets and using these programs, using those applications. So it's a really new challenge for us. We are now almost doing the work of how then doing all the research work on media and have to use the new media and have to transfer like smoothly
Yeah.
to those platforms.
Mm.
But we are still have adapt that
Mm.
those online platforms are all accessible for all.
Right.
So also we, as in our some of our members, we had found of incident of hunger and malnutrition of children. So some of our members, they are focusing on that issue, and they are doing uh, like they are doing the research work. They coming to the on that fields and doing trips in the outskirts of Ulaanbaatar city to
Mm.
see the population. Yeah,
Mm. Mm.
so we are
We,
doing those kind of works. Yes,
right,
for
right.
now.
Right,
Yes.
right. No, thank you so much, because again, I think this is what all of us are sort of struggling with, because a lot of the groundwork, the activity work that we needed to be done with communities that are not probably as tech savvy or as digitally literate, now things are being pushed, and it is a big struggle, it's a big challenge, because digitization needs a certain literacy, and that is not there in many of our countries. And so it's definitely a real struggle, and I totally understand what you're saying, Anu, and all of us are, I think, in the same situation right now. So my question, my sort of the second final question to you is, what are the sort of, out of all this that you just said, the challenges, the issues that you're facing, the communities that you work with, out of all the challenges, what you think are the main learnings, the key takeaways that can inform the the next transformative changes that we demand, that we request, or we ask, and we sort of so that we can move towards that better world? What do you think could be the big asks from?
Yeah, sure. Um, uh, I just want to add
Yeah.
one thing
Yeah.
to the previous question, because
Yeah.
also we just adopted the COVID law, temporary COVID law.
Okay.
Yes, so that law was also had some mm, some uh, excuse me, restrictions and which could like violate the human rights.
Okay.
So as a part of a movement, we had also um, did some analysis on the COVID law and had our comment included in the alliance.
Okay.
So anyway, the law is adopted, but some of those kind of um, provisions they didn't include the parliament. So that's kind of one
Mm.
the success during this kind of situation
Right.
for the civil society community.
Right. Right.
So yes, advocating on those kind of issues,
Right.
on
Right.
the broader human rights issues.
Right.
Because
Right. Could you give us an
yeah,
example of that? Like, what was the provision that was that you advocated for, and how did it? Yeah.
Yeah, it's mostly we're on the right of free speech.
Okay.
Yes, on the right of free speech,
Okay.
and on the regulation were related on the misinformations and fake news and stuff, but it was really like vague how they will regulate it. So yeah, it's mostly were on the issue of the free speech.
Okay. Thank you for adding that,
Yeah,
because I think it's, yeah. Sorry, go on.
and yeah, as to the last question, yeah, this pandemic like really surfaced the issues that we already had for many years, and the key takeaways uh, for our colleagues, for our team, for our organization is that um, women are still doing like a greater job. They are doing a lot of care work, which is paid, also mostly unpaid care work. So we should really focus after this pandemic on the issue of women working in the healthcare sector, also women doing all kinds of care work. Yes, and excuse me, and also we should also more focus on the issue of domestic violence. We thought we almost overcoming the issue. We thought we were successful on fighting domestic violence because we had those revised law on domestic violence, and the services were getting better, and the police and all healthcare, everything were responding to the domestic violence like as they should do. But during these pandemics, it's really revealing that we should also really move forward fighting domestic violence and gender-based violence overall. And there is like really a deep-rooted like culture or settings in the home where like these reports were these domestic reports were increased because like a lot of men were drinking in their houses because all the other like bars and restaurants, they were closed after 10, which is like quite early than usual. So there is like really deep rooted those kind of power relations. Also economic issue is under the under this domestic violence
Right.
called spike. Yes.
Right. Thank you so much. Congratulations to your team, your organization, and the movement that you were a part of, the civil society movement that could actually resist that provision and change it. So get an amended bill passed in the parliament. So so congratulations on that, and I think that is what underlines the importance of the civil society movement in countries around the world. Thank you so much, Anu, for joining us. We'll say goodbye to our audiences and end the interview. And if you have more questions, write to us at discussions.acp@gmail.com, and we'll stay in touch. And Anu, we'll also stay in touch. So thank you so much. Bye.
Thank you for having me. Bye.
Bye.